You may begin.
We all see different stories, videos, and news reports of more and more babies being born withdrawing from illegal drugs. It is estimated that about 15% of babies each year are born addicted to illegal drugs. 6% of pregnant women in the U.S. alone use illegal substances such as cocaine, heroin, and more while pregnant. According to the JenniferAct.com, every 25 minutes a baby is born suffering from opioid withdrawal. Illegal drugs such as these can seriously affect the growing child for years. This graph shows the statistics of drug use during pregnancy in the year 2013 to 2014 in the U.S. And as you can see, marijuana use was with over 120,000 pregnant women, and cocaine was more than 90,000. So the graph shows pretty substantial numbers, as you can see. Each drug causes different effects on developing children, and some are more serious than others. Each stage of the child's life can be affected, with complications affecting both physical and mental development. This is a serious issue that impacts the child throughout their whole life. I have experienced some of these firsthand, as I have cousins who were born to drug-addicted mothers. The outcome is not pretty and has tremendous effects to everyone surrounding the child. There are many different types of illegal drugs. Heroin is an opioid drug made from morphine, and it can be in the form of a white or brown powder or a black sticky goo-like substance, also known as black tar heroin. This drug can be snorted, smoked, or injected. Cocaine is a street drug in the form of a white powder, and it can also be snorted or injected or smoked if it's in the form of crack cocaine. Methamphetamine is a crystal-like substance that is most commonly smoked, but people can also snort it or inject it if they figure out a way to. And opioids are prescription drugs that are often mistaken or misused, and marijuana is a smoke drug that also causes many issues when it is used during pregnancy. All of the drugs previously stated easily cross the placenta and enter the baby's circulation through the thin placental membrane. According to the official journal of the American Academy of Pediatrics, drugs affect the fetus in many ways. It can lead to abnormal growth and/or maturity, alterations in neurotransmitters and their receptors, and abnormal brain organization. Placental abruption can occur, which is where the placenta detaches from the uterus before birth, which can cause heavy bleeding both internally and externally, and is often fatal to both the mom and the baby, according to marchofdimes.org. While in the womb, the baby can also develop many birth defects, which are health conditions present at birth that affect either mental or physical development for the baby. SimmonsFirm.com lists a few, such as cleft lips and palates, heart defects and genital defects, spina bifida, brain damage, glaucoma, abdominal trauma, deformed limbs, skeletal abnormalities, and dysmorphic facial features. One birth defect that I would really like to touch on is amniotic band syndrome. This is a condition where amniotic bands grow and wrap around the baby's limbs, often cutting off circulation so that the babies are born either without those limbs or with serious deformations of their limbs. And I personally have a cousin who was born with amniotic band syndrome due to her mother using drugs, and she suffered from many of these negative side effects, including both the physical and mental development issues. She was born without any fingers on both of her hands and no toes on either of her feet, and she is also very behind those her age when it comes to growth and mental capabilities. Many issues also arise during the fetal period. Babies who are exposed to drugs can be born premature, which means they are born before 37 weeks of age. And they also are born with low birth weights, which means they weigh less than 5 pounds and 8 ounces. I also have another cousin who was born to another drug-addicted mom, and he is now over a year and a half old, and he just now started walking and crawling, and his sister is over a year younger than him, and she's already bigger than him because he was born premature and with really low birth weight. And the two most devastating issues that arise during birth is stillbirth, which is where the baby is obviously born dead, and then neonatal abstinence syndrome. Neonatal abstinence syndrome is where the baby is born withdrawing from illegal drugs. As I talked about above, a baby is born every 25 minutes with this, and that means that approximately 22,000 babies were born with NAS in 2012. MedlinePlus.gov provided several symptoms of NAS, including tremors, rapid breathing, seizures, sweating, vomiting, diarrhea, and much more. And there is a short video clip that I would like to show that has just one of the symptoms of NAS. That video showed a baby with tremors who was withdrawing from drugs. And the average hospital stay for babies born with NAS is about 17 days, says statnews.com. However, some stays can last more than several months. After weaning the baby from the drugs by administering small doses of the substance day by day, the effects still last into childhood. Some of these effects include a developmental delay in speech or language impairment in early childhood, says cdc.gov. Drugs can also cause many physical defects. Babies born to drug-addicted mothers are often born very small, as I said earlier, and drug use while pregnant is often associated with disproportionate weight-to-height ratios. It can also cause breathing issues and heart complications for the baby. In a study done by several professors and doctors, children born addicted to drugs who were tested as newborns experienced abnormal motor activity such as jitteriness, hyperactivity, abnormal head or trunk control, and much more. It is also noted that children exposed to prenatal drug use score significantly lower on measures of language, school readiness skills, impulse control, and visual attention span, according to several researchers. Most drugs affect the child in the same ways, but some also have unique characteristics. Cocaine constricts blood vessels, which causes the oxygen being delivered to the baby to fall for about 15 minutes following a high dose, and this alters the production of neurons, the formation of synaptic connections, and chemical balance of fetal brain. It also leads to physical malformations of the central nervous system and heart, brain hemorrhages, and growth retardation. In a scholarly article by multiple authors, it is revealed that cocaine use during pregnancy is linked to lower birth weights, smaller birth lengths, and smaller head circumference. Heroin/methadone, it makes the child less attentive to the environment around them and causes their motor development to be severely slow. Methamphetamine causes the heart rate of the mom and baby to increase rapidly. AmericanPregnancy.org states that babies born can also suffer from NAS, and experts believe that it is linked to learning difficulties as the child gets older. ScienceDaily.com says researchers studied 151 children exposed to methamphetamine before birth and 147 children who were not exposed to the drug. They found that the children with prenatal methamphetamine exposure were 2.8 times more likely to have cognitive problem scores than children who were not exposed to the drug using a test known as the Connor Parents Rating Scale. Prescription drugs are often related to all of the general effects, but they also include many malformations of the eye, ear, skull, brain, heart, and immune system abnormalities. Some medications, such as antidepressants, are also linked to high blood pressure in infants and respiratory distress. Marijuana, makes your child more at risk for premature birth, and it is also linked to developmental delays throughout their lifetime. Marchofdimes.org says that women who smoke weed during pregnancy also put their baby at risk of developing anencephaly, which is a neural tube defect resulting in missing parts of the brain, skull, and scalp. And a lot of times children with this defect are, they don't make it to birth, or they die very shortly after birth. It is a very, very sad defect. And this website also says that babies are at a high risk of forming anemia as well if the mother uses marijuana while pregnant. With all of the information previously stated, it is clear that drugs severely affect a child's development in many different ways. Not only do these children show signs of physical developmental delays, many also show signs of slower mental capabilities than others who were not exposed to prenatal drug use. Outcomes of prenatal drug use are serious and pave the way for a life full of extreme need of accommodations and hardship. If you or someone you know is pregnant, fully research the effects of the different drugs or medications taken before the baby suffers.